Thank you. This is pretty good. People usually don't have a hard time hearing me. This is pretty good. You speaking right? Thank you, everybody. Thank you for coming. I really do appreciate it. This is not long. This is about 4 minutes, so bear with me. Before coming to Morristown Memorial, I was just a young resident at the University of Virginia in Charlottesville, Virginia. I remember well one particular incident back then. I was prepping the back of a middle-aged woman for vaginal hysterectomy, for whom I was going to administer spinal anesthesia. She was sitting up, and I washed her lower back off with betadine. Then I drew up 2 cc's of 1% lidocaine with a 25-gauge needle for the local anesthesia. And then I said, "Okay, ma'am, now there's going to be a small prick in your back." Without hesitation, she said, "You don't need to belittle yourself like that, Dr. Levy." I said, as everybody in the room, including my attending, burst into laughter, I just said, "Excuse me, ma'am?" It went right over my head. Only then did I realize the faux pas in my choice of words. That incident quieted me for a while, but as those of you who know me well will attest to, being quiet for long is not one of my strengths. So now here we are 30 years later, and the Israeli Bond Office calls to tell me that I was chosen to be an Israeli Bond physician honoree. And they add that I am the first anesthesiologist to be so chosen. To hear that was particularly nice because anesthesiologists frequently get so much verbal abuse. Yes, you know, all those crude lines about passing gas. Anesthesiologists just have to smile and stay diplomatic. And there are all those patients who ask, "Are you a real doctor?" By the way, we are. And recently I heard one surgeon say, "You know the ABCs of anesthesia?" Now, of course, I presumed he meant airway, breathing, and circulation. But no, instead he said, the ABCs of anesthesia, you know, airway, billing, and coffee. At least he put airway first. So yes, I was rather surprised and humbled when a few months ago in February, I received that call from the Israel Bond Office. I would like to believe that I was chosen to be an honoree for my sincere belief in Israel as the homeland of the Jewish people. I also believe in putting action behind one's beliefs, and I'm not afraid to ask people to do the right thing, something taught well to me and my sister Arlen and Marcia, but by my parents Jean and Leonard Levy, sitting right there in front of me at the table. Along those lines, I had a funny incident just last month. I was administering anesthesia at the James Street Surgery Center, and I used that opportunity to talk to the surgeon that was there that day. It was a Dr. Mitch Carter, about the importance of investing in Israeli bonds. And a scrub tech in the room interrupted me to say that she understands that Israel is surrounded by all those hostile enemies, but that I was inappropriate to push anybody to buy Israeli bonds. I laughed and said, "No, I said Israel bonds, not bombs." That's a true story. So probably all of us are inundated with requests from innumerable Jewish organizations asking us to give money. Today, as you have already heard, we're not asking you to give anything. I have bought Israel bonds in the past for my wife Barbara and for my daughters Jessica and Dawn, fully expecting to get every cent back, plus some interest to boot. And if I'm wrong and I don't get my money back, that means there is no longer an Israel, God forbid. I don't know about you, but if Israel were destroyed and I had not done my share with some kind of investment to help strengthen Israel, I would feel pretty awful. Yup, on occasion, it may be tough to be an anesthesiologist, but it is always tough being an Israeli living under a constant daily threat. I just want to help. So I thank you for this honor to make public my zeal for the state of Israel. By the way, last year, Darren Blumberg was honored here right at this Israeli bond dinner. He is 5'5" tall at best. Darren, stand up. This year, at only 5'3", I'm up here, and yes, I am standing. So the trend is obvious. If there are any vertically challenged doctors out there, you're a shoo-in to be picked next year. So thank you all for coming, and please do help Israel. It is easy to do, and Israel needs it. Thank you.